Assalamualaikum and hello, good morning everyone. The person that I respect, Associate Dr. Muhammad MIJANUR Rahman is our lecturer in animal reproduction. I like to take a moment to introduce my incredible team, Mr. Qamarul. Now, without further, let's start and explore our presentation with the title Repeat Breeding in Cattle. As an introduction, we will discuss what is meant by the repeat breeding. For your information, repeat breeding in cattle is a significant reproductive problem in the dairy and beef industries, characterized by cows that fail to conceive after multiple insemination despite having normal estrous cycles and no apparent anatomical abnormalities. These issues lead to economic losses due to extended calving intervals, increased veterinary costs, and also reduced the milk production. What the definition about a repeat breeder cow is. The first is its dad has been bred three or more times but not conceived. The number two is has a normal estrous cycle. The number three is free from palpable abnormality. The second one is has no abnormal vaginal discharge. The next is has a calf at least once time. And the last is cow less than 10 years old. This is the etiology of the repeat breeding. The first is the fertilization failure, and the second one is the yearly embryonic death that can affect by repeat breeding. What is it? Number one is genetic, by the genetic. The second one is by the artificial insemination. The third one is environment. Fourth is uterus. And the last one is ovarian function. And now we will story by the factor of affecting repeat breeding. The number one, poor reproductive health, which is these issues such as uterine infections, hormonal imbalance, or anatomical abnormalities can affect the animal's reproductive health, leading to repeat breeding. The second one is nutritional deficiencies. This is can affect reproductive performance in animals. Deficiencies in essential nutrients like vitamins and minerals can impair fertility. Next is genetic factor. Genetic predispositions can affect reproductive efficiency also in animal. Some genetic condition may lead to reduced fertility or increased rates of repeat breeding. The next is infectious disease. The fact is certain infectious disease such as brucellosis or leptospirosis can impact reproductive health and result in repeat breeding. Stress also can affect to the repeat breeding by the high level of stress, whether due to environmental factors, handling, or social dynamics, can disrupt reproductive process in animals, leading to repeat breeding. Second one is the management practice. By this management, such as improper timing of mating, inadequate heat detection, or poor semen quality can contribute to the repeat breeding incidents. Number seven is age. By the advanced age can decrease fertility in animals, leading to the repeat breeding as the reproductive system can decline with age. Number 8, environmental factor. By the extreme temperature, poor housing condition, or exposure to toxins in the environment can negatively impact reproductive performance, also to lead to the repeat breeding. And the last one, by the behavioral issues, by the aggression or dominance within a herd or group can affect mating behavior and may result in repeat breeding incidents. So, addressing this repeat breeding often require a comprehensive approach. So, including veterinary evaluation, nutritional assessment, management adjustment, and also sometimes genetic selection to improve reproductive outcome in animals. Now, we go to the next. We talk about diagnosis and evaluation of the repeat breeding. By the diagnosis and evaluating repeat breeding in animals involve a systematic approach that consider various factors influencing reproductive performance. So, by the history taking, gathered information about the animal reproductive history, including previous mating or insemination attempts, any known health issues, nutritional status, and management practices. Number two is physical examination. By conduct through the physical examination to assess the animal overall health, reproductive anatomy, and any signs of illness or injury that may affect the fertility. The third one is by the reproductive examination, by the perform specific reproductive evaluations, including assessing estrous cycle, regulatory regularity, evaluating the integrity of the reproductive tract through the palpation or ultrasounds, and checking for any abnormalities such as infectious or cysts. Number four is hormonal assessment. From the major hormone level, such as progesterone, estrogen, and luteinizing hormone (LH), to the evaluate ovarian functions and estrous cycle dynamics. So, abnormal hormone levels can indicate the hormonal imbalance or reproductive disorder. The next is by the semen analysis. If applicable, evaluate the equality of the semen in males through the semen analysis, including parameters such as a sperm count, mortality, and morphology. Poor semen quality can contribute to the repeat breeding incidents. Number six is by the diagnostic imaging. By the utilize imaging techniques such as ultrasounds or radiography to visualize the reproductive organ and detect any abnormalities such as uterine infections, cysts, or the structural defect. Number seven is by the endometrial biopsy. In cases of suspected uterine disorder of chronic infertility, an endometrial biopsy may be performed to assess the health of the uterine lining and identify any inflammatories of or degenerative changes. The number eight is by the infectious disease testing. Screen for infectious disease known to affect reproductive health, such as brucellosis, leptospirosis, or bovine viral diarrhea (BVD), through the serological test or polymerase chain reaction (PCR) assays. Number nine is by the nutritional evaluation. By the assess the animal's diet and nutritional status to identify any deficiencies of or imbalance that may impact reproductive performance. So, from the adjustment to the diet may be necessary to optimize the fertility. And number 10 is environmental assessment. Through the evaluate the animals, housing condition, management practice, and exposure to environmental stress to identify potential the factors contributing to repeat breeding. And the last one is by the genetic evaluation. We consider the genetic factors that have may influence the fertility. So, such as hereditary reproductive uh, disorder or inbreeding depression, especially in breeding program. So, by integrating this diagnostic approach, veterinarian can identify underlying cause of repeat breeding in animal, also can develop target management and treatment strategy to improve reproductive outcome.
Assalamualaikum and very good day to Associate Professor Dr. Muhammad Mijanur Rahman, Lecturer for Animal Reproduction, Semester 2, 2023 and 2024. Uh, my name is Qamarul Hafiz bin Jaafar, matrix number YL 2111018. Uh, will present for the repeat breeding in cattle. This is for my part for management strategy for repeat breeding. For the nutritional management, we need to ensure animal receive balanced diet that meet their nutritional requirement for reproduction, supplement deficiency, and adjust the feed according to the reproductive stage. Reproductive management is implement strict heat detection program to ensure mating or insemination occurs during the optimal fertile windows. Use synchronized breeding protocols to improve consumption rate and reduce the incidence of the repeat breeding. Consider assisted reproductive technologies such as using artificial insemination or embryo transfer to overcome fertility issues. For third is health management, we need to maintain comprehensive health program, including vaccination protocol and parasite control, to prevent the infectious disease that can impact reproductive health. Treats any reproductive tract infections promptly with appropriate antibiotics or veterinary interventions. Monitor and manage reproductive disorders such as cysts or uterine infections through veterinary care and target treatments. Fourth is the consultation with veterinarians and specialists. We need to find the seek guidance from veterinarians and reproductive specialists for complex cases or when conventional management strategies are ineffective. Collaborate with the expert to develop customized treatment plan and optimize reproductive success. Six is genetic selection. So we need to select breeding animal based on fertility and reproductive performance, avoiding individuals with history of repeat breeding or non-genetic defect. Incorporate genetic testing and pedigree analysis into breeding program to reduce the risk of hereditary reproductive disorders. Six is stress reduction. Minimize stress minimize stressors in animals environments such as overcrowding, excessive noise, or abrupt changes in routine which can disturb reproductive process. Provide comfortable housing condition with adequate space, ventilation, and bedding to prom- promote reproductive well-being. Seven is record keeping and monitoring. We need to uh, record all day the maintain details record or of reproductive events, including mating dates, heat cycle, and pregnancy outcome to identify patterns and potential issues. Regularly monitor reproductive performance indicators such as conception rate and calving lambing interval to assess the effectiveness of management strategy and detect problem yearly. At is education and training. We need to educate animal caretaker and staff on proper breeding management practices, including including heat detection, how to uh, detect the heat or mating procedure, and reproductive health monitoring. Also, we need to provide ongoing training and support to ensure adherence to best practice and continuous improvement the reproductive outcome. For the hormonal treatment for the repeat breeding is progesterone therapy, gonadotropin releasing hormone analog, progress-landing F2A, estrogen therapy, insulin sensitizers. Next is the reproductive efficiency for the repeat breeding. For the first is estrus detection and timing. Implement reliable estrus detection methods such as visual observation, tail pen, heat detection patches, or electronic estrus detection system. Uh, Train personnel to accurately identify sick sign of estrus, ensure timely breeding or insemination to maximize conception rate. Second is synchronization protocol. The synchronized protocol is we need to utilize to synchronize estrus cycles and optimize breeding efficiency. Incorporate protocols involving prostaglandin F2A, progesterone, and gonadot- gonadotropins releasing hormone GnRH to ensure estrus and ovulation in control method. Third is genetic selection. We need to select breeding animals with superior reproductive traits, including fertility, heat expression, and so calving ease to improve overall reproductive efficiency. Also consider using sires with high fertility index and proven reproductive performance to sire replacement heifer and improve the breeding protocol of the herd. Fourth is the nutrition and body condition. Uh, Provide balanced nutrition to support optimal reproductive function, ensure cow meet their energy and nutrition requirements through the production cycle. Monitor BCS or body condition scores regularly and adjust the feeding program to maintain cow in moderate to optimal body condition as both undernutrition and over condition can impair fertility. 6. Health management. Implement vaccination program to prevent reproductive disease and reduce the risk of the uterine infections such as metritis or endometritis, which can contribute to repeat breeding. Also maintain the robust health management program, including parasite control, vaccination against the infectious disease, and routine veterinary examination to ensure herd health and reproductive performance. Six is the fertility testing and diagnosis. Conduct the fertility testing, including semen evaluation in bulls and reproductive tract examination in females to identify the potential fertility issues and address them promptly. Utilize diagnosis tools such as ultrasound and reproductive hormone to ensure assess reproductive health and diagnose condition contributing to repeat breeding. Seven is the record keeping and monitoring. We need to maintain accurate record of breeding dates, conception rates, calving interval, and reproductive event to monitor herd reproductive performance and identify trends or patterns. Analyze data regularly to evaluate the effectiveness of management practices and make informed decisions to improve the reproductive efficiency. Six is for veterinary support and consultation. We need to collaborate with the veterinarians and reproductive specialists to develop customized reproductive management plan tailored to the specific need of the operation. This is important. Seek the veterinary assistant for diagnosis and treating reproductive disorder, implementing fertilized enchanting strategy, and optimize reproductive efficiency in herd. For the conclusion, in conclusions, repeat breeding in animals poses significant challenges to reproductive efficiency and overall herd or flock productivity. Addressing repeat breeding requires a multifaceted approach that considers various factors contributing to fertility issue. Second, from the accurate estrus detection and synchronization protocols to nutritional management, healthcare, and genetic selection, proactive measures are essential for minimizing the repeat breeding incident and optimize reproductive outcome. And by the identify the addressing reproductive disorder, nutritional deficiency, genetic predisposition, and environmental storages, sterosis producers can improve the fertility rates, reduce calving interval, and ensure the profitability of the operation. Next is our references. Uh, Thank you so much and good day. Thank you.